And this video is for PT 801 as part of AT Still University Health Sciences, and I'm going to be showing you the Dick's Halp Hike maneuver in assessing vertigo in BPPV. So, Patty, I'm going to have you sit on the pillow here, and you're going to turn to face me with your head. And looking at your eyes for any nystagmus. And then hold this position for about 30 seconds. In the next position, I'm going to have you keep your head rotated looking at me. I'm going to lay back quickly and keep your head rotated turned towards me. And your ear is going to be down, okay? Ready? Mm-hmm. Okay, 1, 2, 3. Down. And with that ear down, I'm looking for nystagmus. I'm holding this position for 30 seconds. But for video purposes, we're going to come back up, and I want you to keep your head rotated towards me. Ready? 1, 2, 3, and up. And looking for nystagmus again in this third position. And this is for assessing nystagmus as if it were in her right ear, because that's the ear that's positioned down. And for positioning to look and assess for vertigo and BPPV in the other side, we would turn her head to the other side and look on the other side. That's it. Procedure. And we're going to start with her turning her head to the affected side. So turn to look at me with your head. And very quickly we're going to lay you down and your head's going to be extended. Ready? Go. Looking at me, you're turning your head like this. And we're waiting here for 30 seconds. And looking for nystagmus. And now 30 seconds has passed, and we're going to turn your head very quickly to look at the other wall. Ready? And I'm looking for nystagmus. And waiting here 30 seconds. So for video purposes, our 30 seconds is over, and now you're going to roll onto your side, Patty. I'm going to help you keep your head in this orientation. So bend your knees, roll to your side. And looking for nystagmus. Now 30 seconds has passed, and I'm going to help you sit up. Ready? Darroch rehabilitation exercises for BPPV to do at home. Patty, I want you to turn your head to the affected side, and now you're going to lay down onto this side looking up and bring your feet up on the table. Go ahead. Now you're going to stay there for 30 seconds, and you may feel dizzy and nauseous. Just hold it there. That should subside for 30 seconds. And then as you feel better, you can go ahead and sit up and pause in the middle. There you go. And now you're going to turn your head to the opposite side and lay down looking up. Again, you may feel dizzy, you may have some feelings of nausea, there might be some nystagmus, but it should subside. 30 seconds, and go ahead and sit up. A Samant maneuver for treatment of BPPV to the right side. So Patty, you're going to turn your head to the right side. And you're going to lay down looking up. So this is opposite how we practice it. So lay down looking up. You're going to hold that for 30 seconds. You may feel dizziness, nausea, but it should subside within about 30 seconds. And now when you sit up, you're going to go all the way over to the other side and look at the table. Ready? Go. Up, down, look at the table. And holding that for 30 seconds. Again, your dizziness and nausea should subside. And now it's been 30 seconds, and now you can sit totally upright. Is the Dynamic Gait Index test developed by Shumway Cook to assess a person's ability to modify their gait in response to changing tasks and assessing their balance. It has 8 items with a score of maximum of 3 points for each item, and it's been determined that with a score below 19 of 24, an individual has an increased fall risk. So Patty, the first item is you're going to walk at your normal speed 20 feet. So ready, go ahead. This is changing speeds. Patty, I want you to walk at your normal speed to the first mark, then as fast as you can at the second mark, and then at the third mark walk as slow as you can. Ready, go. Normal speed. Now fast as you can, now slow. Is walking with horizontal head turns. Okay, Patty, start walking. And when I tell you, start turning your head now. Start turning your head. And now just walk straight ahead. Is walking with vertical head turns. Okay, Patty, start walking normal. Now start nodding up and down. And now just walk normal. This item is a pivot stop. Okay, Patty, walk towards me, and when I tell you, I want you to turn and stop. Turn and stop. Is stepping over obstacles. Patty, I want you to walk towards the box and step over it. Ready, go. Is stepping around obstacles. Patty, I want you to walk up to the cone, step around to the left, come up to the second, step around to the right, turn around and go back and do the same without changing your speed. Okay, ready, go.